Next in my list is Dr. Mansoor Mohammed, who was working at the Federal Medical Center, Azwari in Bauchi State. There's a, a report on there's a report on this on gavi.org, and the in that report, the wife of Mohammed, of Dr. Mansoor Mohammed, was interviewed. The wife is Khadijat Ibrahim, and it stated that after 3 weeks of battling high fever, diarrhea, cough, and bloody vomiting, 35-year-old Dr. Mohammed succumbed to the disease, leaving behind then his young pregnant wife and their 1-year-old son. Later, when she was interviewed about 5 years later, after the death of Dr. Mansoor Mohammed, the wife narrated that Dr. Mansoor Mohammed, he was treating Lassa fever patients. Then he came back home from work one evening in February 2020, feeling sick. Then tested positive to Lassa fever and he was admitted. He died within a month. You know, She said that our marriage was barely 2 years at the time. Our two children are now 6 years and 3 years old, respectively. They are yet to know their father is dead. Dr. Mansoor Mohammed's wife was pregnant when he died, and the their son was about 1 year old. At the time this publication was released, 27th of February 2025, their children are now 6 years and 3 years old. Dr. Mansoor Mohammed, Federal Medical Center, Azwari, Bauchi State, died front line of taking care of patients who had Lassa fever. Next on my list is Dr. Nduku Shizaram. She was a resident doctor, pediatrics department at the Federal Medical Center, Umuahia, Abia State. She died April 2018, barely a month into her job, just like Dr. Victor Idowu. She reportedly contracted the disease after attending to an 11-month-old baby who also died and was suspected to be the index case. She was transferred to Irua Specialist Teaching Hospital, Edo State, where she died April 2018. Dr. Shizaram contracted it from an 11-month-old baby. Dr. Victor Idowu Ahmed contracted it from a 7-month-old baby. And so we can see here doctors contracting it from babies. Then we see the risk that doctors who are treating children, doctors who are treating pregnant women, and doctors who are treating patients who are known to have Lassa fever, can see the risk that they all face. Now, I'll move on to Dr. Esa Oga and Dr. Victor Owantu. I take them together because they contracted the Lassa fever virus from the same patient. This was reported in Nasarawa Mirror, which is a newspaper, December 15th, 2021. That was when this report was posted on Facebook. It's an account of a colleague to Dr. Esa and Dr. Victor. The Colleagues stated that the double tragedy at Dash Lafia. This is the sad story of the untimely deaths of two gynecologists at the Dahatu Araf Specialist Hospital, Dash, that's in Lafia, Nasarawa State, recently. So the sad story of the untimely death of two gynecologists at Dash recently. Dr. Victor Owanto is a new fellow obstetrics and gynecology, became fellow April 2021, while Dr. Esa Oga was employed in 2017. So he's an older consultant. He's a consultant obstetrician gynecologist employed in Dash in 2017. The case was that of a woman with severe PPH, that's postpartum hemorrhage, bleeding after delivery, for whom Dr. Victor Wanto had earlier done uterine artery ligation. Postpartum hemorrhage is a common and dangerous complication in women who have put to birth. And one of the procedure that is done to save the woman, to rescue the woman from that excessive bleeding, is to do the uterine artery ligation, which Dr. Victor Nwato did, the junior consultant. So, but the story goes on. However, the bleeding persisted, and Dr. Esa Oga had to do hysterectomy. Hysterectomy is the removal of the uterus of the womb. So, the last resort, if or there are several steps taken to address a woman who is bleeding after delivery. And if nothing works, the final result is to remove the uterus, to remove the womb. And that is what Dr. Esa Oga did. And Dr. Victor Wanto, the junior consultant, assisted Dr. Oga during the procedure to remove the womb of this woman who was bleeding. The plan to perform hysterectomy was discussed as a case of uterine atony, but little concern was placed on the surgical presentation of Lassa fever. Eventually, the patient died. But at that time, they didn't suspect it's Lassa fever. Both surgeons later took ill, that's Dr. Esa Oga and Dr. Victor Nwanto. Dr. Victor traveled back to his family at Abuja from Lafia, because Lafia is not far from Abuja. So, and Dr. Victor was managed as a case of malaria. He eventually died on the 5th of December 2021 at the age of 43, and survived by his wife and 4 children. This prompted a review of the corpse, and the diagnosis of Lassa fever was confirmed on the 6th of December 2021. The lead surgeon, Dr. Oga, was also confirmed to be Lassa positive and eventually died early today. That day was Tuesday, 14th December 2021. Then this colleague of theirs went on to write, even as we strive to save lives, let's continue to remember the doctors as well as other health workers. Let's continue to remember the doctors as well as other health workers' lives matter by ensuring and insisting in adequate protection from all workplace threats and dangers. May the soul of Dr. S. Okay, okay. So may the souls of Doctors Esa Oga and Victor Nwanto rest in peace, and may the good Lord continue to protect us. hashtag adequate protection, hashtag doctors' lives matter, hashtag rest in peace, Doctors Olga and Owanton. Colleague is identified here as Casual Bola was one that wrote it and it was posted by Nasara Mirror.